Thank you. Thanks very much. Thanks for being here. Thanks for your service to the country on it. I've got a ton of questions. Let me start trying to be able to run through some of them. Your report references children who lost a parent to COVID-19, which has been dramatic for us in Oklahoma, obviously. We've had a lot of children that have lost a parent. Bereavement's a very real issue, dealing with mental health issues for children. Somewhere around 15 to 20%, we're still getting the exact numbers in, of children that have lost a parent to COVID-19, which would mean 80 to 85% of the children that have lost a parent lost their parent to something else on this. So my question is for your report on just the focus here of how we deal with bereavement in children. How do we keep this as a broader focus and not just make this a COVID-19 focus in particular? Because obviously we're going to get through COVID-19 together on all this. We're still going to have the other issues of cancer and suicide and so many other issues where children deal with bereavement. How do we keep that broader perspective?
Well, Senator, I appreciate you broadening the lens there, because you're right. Many of our kids have been struggling, losing a caregiver before the pandemic, and this is going to be a challenge for us post-pandemic. I think there are a few things I think that are important. Right now, as you know, there are federal funds that are provided often to support the services for foster care and for other services that kids may need when they lose a caregiver. And while I think there is more that we can do legislatively, Senator, in terms of providing more support to those local institutions that provide the safety net for kids, right, I think this is a time also where, in addition to the government, we need communities to pull together around these kids. These kids aren't just going to need help for a few months or for a year.
It's a lifetime.
It's a lifetime. Yep. And the trauma also that goes into the loss of a caregiver is extraordinary. We're learning more and more, Senator, as you know, about adverse childhood experiences and the impact of that trauma on the long-term health of a child. Having trauma-informed care, ensuring our healthcare providers are trained in how to address trauma early on in the provision of care, making sure schools have counselors that are also attuned to how to provide trauma-based care. This is going to be essential to caring for those.
It'll be a big deal for us long-term. Neighborhoods, communities, extended family, churches,
Yes.
We've got to have a whole engagement within communities for this. One of the things that we need to be able to look at as a committee, and that I'd love to be able to partner with HHS on how we actually fill the gap, is I've learned about 50% of the kids that have lost a parent are not getting their Social Security benefits based on that. And so we've got to be able to find a way to be able to make sure that we're getting some of that support to them, and that's something I'd like to be able to partner together on. Your report also has mentioned dealing with marijuana use in children. We've seen substance abuse go down in several areas during COVID-19. The exception has been marijuana use that has gone up. And I'm sure there's a lot of factors on that. Obviously, the availability. So many different states have found ways to be able to make marijuana legal in their state. But for youth and adolescents, this has become a very serious issue. You've made some comments on this. I'd be interested to be able to drill down on the effects with youth and marijuana use and depression.
Yes, Senator. So when it comes to youth, I worry that there is a perception that marijuana is completely harmless in children. Our data tells us otherwise. Our data tells us that, in fact, that a substantial minority of people who use marijuana will actually develop an addiction to marijuana, and that number is significantly higher among youth. When kids also have underlying mental health conditions, the impact of marijuana use can also be more significant. And so I worry, Senator, about the messages that we may send that say this is utterly harmless and there's no problem here. I think we need to be responsible in how we teach our kids about marijuana. I think how we talk to families about marijuana use. And I think healthcare providers also need to be empowered to have these conversations with youth early on, as well as teachers.
Yeah. We've got to find a way to get that message out. That message is not getting out. Obviously, they're seeing the role models of other individuals using marijuana, and there doesn't seem to be any voice that's out there talking about the real damage in youth in this area, especially, and how they deal with depression and other issues. I have a challenging set of questions I want to be able to walk through as well on it, dealing with another mental health issue and long-term effects, and it deals with gender dysphoria among children, especially, and how we process this on the medical side So puberty blockers, cross-sex hormones, receiving surgical procedures to attempt to change the appearance from their biological sex among children. There have been some studies that have happened, but there's also studies around the world that are raising new questions for adolescents in those areas and saying you've got someone 13, 12, 14 years old that are taking some of these medications. Long term, they have serious effects. And when you're dealing with a 12 or 13-year-old, what is the standard for them actually when they're living with those consequences when they're 20, 30, 40? And is their responsibility to be able to put some warnings out and some precautions in this? How do we manage through that right now on a medical side?
Well, Senator, I appreciate you raising this. I mean, this is a very complex issue, as you know well. And I think what families need at a point like this is they need clear guidance from the medical community. I think as the research has evolved and as guidance has evolved on how best to take care of children in these circumstances, one of the things I worry about is that change propagates slowly in the medical profession. The time from when you make a discovery, for example, to when it's completely reflected in clinical practice often takes years. We can't afford that kind of time frame here. We've got to do a better job putting our best minds together in government and outside of government in terms of medical expertise to figure out how best to care for these kids and make sure then that caregivers and families have that information as well. We've got more work to do there.
Yeah, we do. I don't want the politics today to get in the way of just sound medical advice. To also make information available, and a lot of unknowns that are there, or in what is known in other countries are now stepping up and saying, hey, we're learning more, and there are real problems that are here with infertility and other issues that are there with depression and other things with youth long term that we can't just ignore based on the politics of the conversation, that we lose the health issues. So we need you to give us good health information in that area.
Absolutely. And Senator, I've always believed something I was taught in my first days of medical school, that science and compassion are what should guide care. Those two things, not politics, not opinions, not bias, but science and compassion. We've got to bring the benefit of science, deliver that compassionately to families during a time that can be confusing.
Thank you, Senator Lankford.